Hello everyone. My name is Sandra Martinez, and today I'll be presenting on respecting diversity in nursing, building patient trust, and improving outcomes. Diversity is a vital topic in healthcare today. As nurses, we care for people from many different backgrounds, cultures, and experiences. Understanding how to respect these differences is not just important, it's essential to providing quality care. Let's begin with why diversity matters in healthcare. Diversity includes differences in culture, language, beliefs, values, and life experiences. In a healthcare setting, these differences can influence how patients understand illness, make decisions, and respond to treatment. Research shows that when patients feel respected and understood, they are more likely to trust their providers and follow care plans. So today, we'll explore how respecting diversity improves patient trust and health outcomes. Why is this topic especially important right now? First, the U.S. population is becoming more diverse every year. This means nurses are increasingly caring for patients with different cultural backgrounds. Second, health disparities still exist. Some populations experience worse outcomes due to unequal access, communication barriers, or bias. Finally, from personal clinical experience, even small misunderstandings due to cultural differences can affect patient care. So, addressing diversity isn't optional, it's part of delivering safe and equitable care. Cultural competence defined. To address diversity effectively, we need cultural competence. Cultural competence includes four key components: awareness, recognizing our own biases and assumptions; knowledge, learning about different cultural practices and beliefs; skills, effectively communicating and adapting care; respect, valuing each person and patient as an individual. This framework helps nurses provide care that is both respectful and effective. Cultural competence is not something we achieve once. It's something we continue to build throughout our careers. Background of the issue. Now let's look at the background of the problem. Historically, healthcare systems have not always provided equal care to all populations. This has led to mistrust, especially among some minority communities. There are also challenges such as bias in care, whether intentional or unintentional, communication gaps due to language differences, limited understanding of cultural beliefs. These issues can create barriers between healthcare providers and patients. As nurses, it's our responsibility to recognize and address these barriers. Impact on patient trust. Respecting diversity plays a major role in building patient trust. When patients feel heard and respected, they are more open about their symptoms. They are more comfortable asking questions. They believe their provider truly cares about them. Trust is the foundation of the patient-nurse relationship. Without it, communication breaks down and care becomes less effective. Even simple actions like listening carefully or respecting cultural preferences can make a huge difference. Impact on patient outcomes. Respecting diversity doesn't just improve relationships, it improves outcomes. Studies show that culturally competent care leads to better adherence to treatment plans, higher patient satisfaction, safer, more effective care. When patients understand and trust their healthcare providers, they are more likely to follow their recommendations and achieve better health results. This highlights how diversity directly impacts quality of care. Barriers to diversity. Despite its importance, there are still barriers that make culturally competent care difficult. Some of the most common include language barriers between patients and providers, implicit bias, which can affect decision-making, limited training in cultural competence, time constraints in busy healthcare settings. These barriers can prevent nurses from fully connecting with patients. Recognizing these challenges is the first step toward overcoming them. The first solution is education. Ongoing cultural training can help nurses understand different cultural practices, recognize their own biases, improve communication skills. This can be done through continuing education programs, simulation training, workshops, and real-life case studies. Education empowers nurses to provide more respectful and effective care. The second solution is improving communication. Effective communication strategies include using professional interpreters when needed, practicing active listening, asking open-ended questions. For example, instead of assuming a patient's needs, we can ask, "Can you tell me what concerns you most about your condition?" This approach helps ensure patients feel heard and valued. The third solution involves healthcare organizations. Institutions play a major role by creating inclusive policies, promoting a diverse workforce, supporting patient-centered care. When organizations prioritize diversity, it becomes part of the culture, not just an individual effort. This support allows nurses to deliver better care consistently. To summarize, respecting diversity is essential in nursing. It builds strong patient trust. It leads to better healthcare outcomes, and it is a responsibility every nurse shares. By improving education, communication, and organizational support, we can create a healthcare system that truly serves everyone. In closing, respecting diversity is more than just a concept. It's a daily practice. Every interaction with a patient is an opportunity to show respect, build trust, and improve outcomes. As future and current nurses, we have the power to make healthcare more inclusive and compassionate. Thank you for your time. This concludes my presentation.